About Humanitarian Initiative of the World Congress of Ukrainian World Congress, and the topic is Patriot Defence, Assessment of Medical Services of the Ministry of Defence. Mr. John Quinn, MPH, MD, medical consultant, Ukrainian World Congress, who was doing the assessment, and Uliana Suprun, Director of Humanitarian Initiatives.
Brief us on the results of the medical assessment of the Ministry of Defense. Прошу, колеги. Доброго дня.
Good afternoon. The international humanitarian initiatives of the Ukrainian World Congress, the Patriot Defence, started in May this year as a response to a specific need to teach Ukrainian military to provide immediate first aid during the military actions, organize and to teach the combat lifesaver courses, and to ensure IFAC every serviceman who was trained. The program is financed from the contributions from Ukrainian communities of Australia, USA, Canada, Czech Republic, Austria, and many other countries of the world. The Patriot Defense ensures the participation and training of the foreign professional instructors who are certified according to NATO standards, and Ukrainian trainers of the course of combat lifesaver who have the certificates. In these, who train the military to provide high-quality first aid in conditions of military actions. The courses are identical to those which are taught to military in the NATO in the US, and they are developed by the Institute of the Professional Development of US Army. The military are taught how to provide assistance to themselves and their servicemen, and that is part of their battle task. 4,500 Ukrainian servicemen have already been at these courses, and we distributed 3,600 medical kits. The medical expert, Dr. John Quinn, was invited to understand the basics of the support for the soldiers and volunteers who are involved into the anti-terrorist operation. We are not just going to point out the problems. We suggest resolutions for them, for these problems, which are very well used in the different armies of the world. Now I would like to give the floor to Mr. Lashenko, who from the Ministry of Defense will say a few words, and after that I will give the floor to John Quinn, who finished his assessment of medical services of the Ministry of Defense.
Thank you. I would like to thank the World Congress of Ukrainians who use their experience and to help our armed forces, our medical service. And according to NATO standards, they provide assistance and practical medical assistance, and they train our soldiers to help others. And medical principles of providing first aid under engagement, they are the same, like under Ukrainian standards and also NATO standards. But there is a small difference. The difference is in their first aid kit, and also there are some differences how to provide first aid under engagement, and the instructors provide that assistance and train our soldiers based on international experience. Once again, I would like to thank you for your assistance, that you understand us, and let's cooperate in the future. Thank you.
Good afternoon, journalists, colleagues, military families, and especially the Ukrainian warfighter in the field. My name is Dr. John Quinn. I've been working in emergency medicine for over 15 years in Ireland, the UK, and the US, and I've been performing medical and health assessments in conflict and post-conflict areas like Iraq, Kurdistan, Timor-Leste, and Palestine. 2 months ago, I was asked by the Ukrainian World Congress to carry out such a medical assessment to highlight the medical care rendered to the Ukrainian warfighters from point of injury to definitive care. Ukraine has undergone a social and political revolution with great violence. Presently, there is an active anti-terrorist operation with a determined enemy that is armed with myriad lethal weapon systems and military power. This snapshot assessment was short.
Just very slowly for our interpreters.
I apologize. This snapshot assessment was very short, and a comprehensive medical audit with quantitative data collection and process observation will be needed in the future by the Ministry of Defense. There are shortcomings with this present emergency medical evacuation process currently in the ATO. Number one, the military warfighter, paramedic, and military doctors lack a standardized medical approach to emergency medicine. They lack combat lifesaver training, and for all uniformed troops, they lack NATO standard first aid kits, individual first aid kits, or IFAKs. They do not have combat paramedic programs, and there is no purpose-built rotary wing or helicopter medical evacuation aircraft. There are inadequate mobile military medical hospitals with deficient capabilities. Our colleagues at the Ukrainian World Congress and Patriot Defence, with Dr. Uliana Suprun, have already issued, by supportive donations, over 3,600 IFAKs, or individual first aid kits, with associated combat lifesaver training for over 4,500 soldiers. This has been led by lead instructor, paramedic Patrick Chalou, with over 20 years experience and many volunteer trainers. But this is only a drop in the bucket of the need for the many warfighters that still have nothing and are fighting every day. There is a new collaboration between Patriot Defence and Victor and Elena Pinchuk that has continued and expanded an advanced paramedic training program that is starting this weekend with warfighters in the East. Much work remains to be done. I'd like to share with you some photos from the medical assessment. It's very descriptive in nature. We see here a 1983 donated German ambulance. This is used for the transport of the ill and injured from the ATO and throughout the Kharkiv region. Fuel is an issue, heating is an issue, and next please. Adequate medical care for critical transport is an issue. There are some civilian modern ambulances in use, but not at use in the ATO. There is no armor. This is a completely inadequate resource for medical evacuation of the warfighter. Next. This is another example of a civilian ambulance that is used to take soldiers from the ATO and warfighters into Izum. They see about 10 to 15 to 30 a day. In Izum, this is where the central command structure is, and this is turned into a de facto receiving hospital for trauma patients and for surgical care. Next. This is the triage facility. This is the personal hygiene facility at the Izum triage. So when your warfighters come in, this is where they are waiting to be triaged and treated by nurses and sometimes by clinicians during the hours of around 10 and 2. And this is the triage facility. The next area of the facility, next, is the area where a lot of the wounds are washed off. This is the triage facility for a lot of the warfighters coming in. The next room over has a small bed and a small desk, very minimal resources. Next. We see here a circa 1960s German anesthesia machine and equipment currently in use in Dnipropetrovsk. This is completely inadequate for the surgeries that are taking place. And if you switch to the next slide, you can see the surgical theater. The surgeons that are there are highly trained, highly experienced, and have they lack the resources to do their job adequately. You can see here, these are not modern tables. The floor is coming off the bottom. You can see it's chipping away. Okay, and this is the mobile hospital. I just want to describe, there's hay on the floor here under hard dirt. The first and second rains, this is completely washed out. This mobile field hospital has since been moved, and this is treating about 100 soldiers and warfighters per day, coming in by ground ambulance and air ambulance. About 8 surgeries that they can do per day, but they lack the adequate resources to be able to handle anything more than that at present. We can see here just before the dining facility, again, hay on the floor. This is the hygienic facilities used throughout the camp, completely inadequate for anything other than the months of June and July, to be honest. We can also see that here, this is also a main collection point in the event of an emergency, and it is completely inadequate. This is a tent city, not fit for purpose. The need for a modernized mobile hospital, if not multiple mobile hospitals, is acute. Inside this mobile hospital, water is an issue. Running water is an issue. Potable water is an issue. So what is done is you can see these water filters, and someone's job throughout the day is to make all of this potable water to be on standby for when they get 30, 40 troops that come in. One of the first things that they need, especially for the walking wounded, is potable water systems. This is the main resuscitation bay. You can notice here there is some freshly updated rubber floors for blood and for irrigation purposes. But if you look here, this is the main resuscitation bay with absolutely minimal and inadequate soft and hard goods surgical supplies for resuscitation and adequate care. Lighting is an issue, power is an issue, portable ultrasound is an issue, completely lacking at this facility. This is the other side of the resuscitation bay. Again, lighting is an issue. You can see this light here did not work at the time of the assessment. This cot is completely inadequate for resuscitative care of the warfighter. And this, I apologize that this picture is not better lit, but this is the process of surgical sterilization of the hands for scrubbing in because there is no running water. A lot of colleagues that we met in Kiev thought that a lot of surgeries were being performed at these mobile hospitals because they had great surgeons that had a lot of experience and they had great training. However, they lacked the adequate resources to carry out any of these surgeries, sterilization process being one. And if you go to the next slide, we have, this is the mobile surgery. They have 2 tables. They have 1 anesthesia machine. It's a small Soviet-era anesthesia machine. It is not mobile by any means. There is an anesthesiologist, and while I was there, really the capability was to remove an appendix caught occultly, a very, very basic damage control surgery. I should also note that the walls of the tent was flapping in the wind, and this is inside the hard surgical theater. So this is completely inadequate for the patients that are coming there, especially at about 100 a day at the time of the assessment. Just outside of the tents, we can see more of the hay, and this is some of the hard dirt. This obviously will be washed out and muddy. The helicopters that are used right now are weaponized, and they're used for warfighting activity, and they're pulled out of that circulation due to many being shot down with patients on board the medical evacuation aircraft. So they're down to very basic military aircraft that have no medical equipment, they have no medical crew, and they do not adequately, you cannot unload and offload your patients. They come out, they have multiple stretchers to perform a triage and assessment. If there is any surgery that needs to be done, again, damage control only, in very small volumes, they can march into surgery, do what they need to do, and come out and send the patients further downrange into the receiving hospitals. This is an inadequate process. There's not enough medical staff to reevaluate, to reassess patients. Patients will lose limb purely because of not being able to be reassessed and reevaluated. This is a significant concern with medical staffing and adequate training of those medical staff. This is just a photo on a flight line. We can't tell you where this is taken, however, and whether or not this was for rotary or for fixed-wing aircraft. However, this is the process of civilian ambulances being taken out of circulation to take injured and wounded. Sometimes, because of the use of mobile phones and no encrypted radio communication, they don't even know how many patients will be coming in. Emergency physicians come there in sandals and scrubs, and whether it's raining or not, there's no protection of any kind, there's no personal protective equipment. And the ambulances are shoddily non-standardized in their equipment, and this is the process that then they take the patients. For example, in Dnipropetrovsk, they take it 45 minutes to a receiving hospital, and in some instances longer by ground ambulance. So, just to review from some of the needs, some of the acute needs: combat lifesaver training for all uniformed troops, a comprehensive combat paramedic program, and standardized pre-hospital training for all doctors. This is absolutely acute. The warfighter, paramedic, and military doctors lack a standardized medical approach to emergency medicine and evacuation, and this is where training comes in, and this is where training is absolutely vital. Rotary wing or helicopter, aircraft, medical evacuation, and communication equipment do not exist and are completely inadequate. They are not to a NATO standard. They are nowhere near to a NATO standard. Okay, I just want to keep that slide, and I want to show you some of the medical equipment that we ran into when we discussed some of these questions with some of the patients in the hospital, as well as with some of the warfighters currently in the field. Some received no medical equipment of any kind, and they had nothing. They had their weapon, and they had one set of uniform. Others received a very small medical kit, and inside this medical kit, issued by the military, they received, some very interesting pieces of, I'm not really sure, medical equipment or not. Some things that you can be used for first aid. That some very interesting things like condoms and band-aids. This is not fit at all. This is not to a NATO standard, certainly, but this is not what you give a warfighter. And so that's the inadequacy, and that was addressed by the Patriot Defence and by Dr. Uliana, Suprun, Ukrainian World Congress, and they've been able to issue a NATO standard IFAC. And this IFAC is not cheap. It is quite costly. However, the number 1, number 2, number 3, and number 4 purposes of mortality on the battlefield, this can address, other than massive head injury and massive head trauma. Any major bleeding, major hemorrhage, which is the number 1 cause of death, this with good training, with combat lifesaver training, can save lives, and already has. About 3,600 are in circulation right now. Now, from a paramedic standpoint, it doesn't exist in Ukraine necessarily. It's very new, and the adequate training, the adequate equipment are non-existent. However, the Patriot Defense Force have been able to issue these bags with adequate training, a 5- and a 7-day training course that can not only address basic trauma life support requirements, but can also do ongoing primary care, and can also resupply these IFACs as they become used and some of the elements dwindle. This is a picture. I'm sorry, go back one slide. This is a picture of some of this training that's taken place so far. I've been able to observe a lot of this training. It is to a NATO standard. It is combat lifesaver training. It is the highest standard that is offered in the field of tactical combat casualty care. And this is some training that we can see with uniformed troops and warfighters with combat tourniquets. This is in the back of an APC, and this is a IV therapy. Now, it's very difficult. The culture of medicine in Ukraine is very controversial to this approach. However, this saves lives, specific with hypovolemic shock. Now, this is just an example of how you can take combat lifesavers and teach them IV therapy and indeed save lives. The next picture is of the same side, just another student with some of our volunteer trainers, some of the volunteer trainers that are there. And then finally, this is just showing that you don't need a huge classroom. This doesn't have to be done in a very controlled atmosphere. However, this is some of the theory behind the practical components of the training that we observed, and this is indeed saving lives. So I just wanted to summarize here some of the key findings from this assessment. Specifically, the average time from point of injury of a soldier to first medical contact being 20 to 60 minutes. That first medical contact is not with a doctor. That first medical contact may be with a nurse or another first aid person. This needs to be changed entirely, and we need to have the concept of self-aid and buddy aid. The average time from point of injury to field, hospital, and surgical capability is 8 to 18 hours. In some instances, it was as long as 2 days for some units that were surrounded. And these numbers have been known to lower just because of some of the changes and the evolution of warfare throughout the ATO. Soft and durable surgical supplies in the ATO are completely inadequate for high patient volume, winter weather, and major multi-system trauma. The rotary aircraft used for medical evacuations are dangerous. Contracting and procurement of new or other used purpose-built aircraft is an absolute priority. Individual first aid kits, or IFAKs, with accompanied combat lifesaver training is roughly at about 5% coverage of the uniformed troops. That number needs to be 95 to 100%. The Special Forces paramedic role with advanced trauma treatment capabilities in the field is completely non-existent. There's no armored ambulance transport capabilities at this time. The contracting, procurement of new or used production of vehicles and up-armored vehicles for evacuation casualty care is absolutely acute. And there are Ukrainian firms that we've contacted that are able to do this and are awaiting an order from the Ministry of Defense. Lastly, communicable disease such as polio, gastrointestinal illness, and tetanus present a clear and present threat across the ATO and all eastern Ukraine with inadequate access to consistent basic services, hygiene, prevention, and vaccination. In sum, the urgent requirements based on this assessment taking place: combat lifesaver training for all uniformed and irregular warfighters, a comprehensive and sustainable combat paramedic program, and standardized pre-hospital training for all doctors. Rotary wing medical aircraft with medical equipment and advanced communication is needed, and finally, modern mobile medical capability. The entire assessment and all findings and other key findings and gaps that were identified will be available on the patriotdefense.org website, and we can take any questions at this time.
Thank you so much, Dr. Quinn. Thank you so much, Uliana. Do you have any questions? Yes, we have.
John. Can I say, I have a comment and then I have a question. The comment is this: we're asking people to go to war and fight for their country, and the issues that you're addressing today are about saving the lives of men that have been injured in the field. And my comment is this: the level or the low level of interest in this presentation right now, I think, is actually quite shameful. We're talking about people dying. We're talking about people dying because there are inefficiencies in the system that you are identifying that could be addressed and should be addressed and need to be addressed, and more people need to be paying attention to this issue. That's the first point. The second point, the photographs that you showed of the hospital facilities that I believe were in Kharkiv, the reality is, as anyone that's been to a hospital in Ukraine knows, that is the standard in Ukraine. That is what you will find. It is what you will find everywhere, and it is absolutely the result of the systematic theft of people that have been in authority in this country for many, many years. Identifying the problems is a very important thing, but the question is, what are we actually going to do about it? We've seen where the problems are. You've identified that with your professional experience. We've seen the conditions that we have, and we know what they're a result of. But where are we getting the help that these Ukrainian soldiers both need and deserve? Where is that coming from? You mentioned earlier on that there's expanding ties with Victor and Elena Pinchuk and their foundation. I know that in the past years, they've privately funded the restoration of some hospitals. Is there an urgent request being put to them, for example, or any of the other oligarchs that have charitable foundations? Is there an urgent request being put to them to come up with funding for the refurbishment of these medical facilities as needed? Or alternatively, is there coordination between our military friend here and his ministry and overseas partners who could be providing the equipment that they absolutely have for field hospitals and other things? We're not talking about lethal aid assistance, we're talking about saving lives. So the question is, what's the answer?
I can only probably address a few of those points from that question. There is, and we have one more slide. I just was going to put about some of the further collaboration. One more, just next. Click there next. There is, you know, as you pointed out rightly, the Victor and Elena Pinchuk, as well as Patriot Defence, have started to address some of these issues. But the collaboration with the Ministry of Defence needs to really tighten up, and it needs to become clear on the needs. If you were to look at some of the items from the assessment that I did not address directly because of time, specifically the medical administration and the Ministry of Defense need to have a single voice, that the humanitarian and medical requirements by donors and the international community carry out their core mission. They need to have a single voice, and they need to broadcast that voice. They need to implement a marketing strategy that clearly defines what the Ministry of Defense and what the medical administration need, and from what evidence, and through internal audit and data collection, and specifically what resources and requirements are lacking to make what is their mission goals and what is mission essential. So you raise a very good point. You cannot just fix a system that has been in decay for multiple years over the course of a few months. However, mission critical equipment such as a combat lifesaver bag, such as emergency ultrasound equipment, which are not currently in situ, these can be addressed. These are mission critical, and these items can be procured and put into use, trained, and put into mission status immediately. When it comes to the system, looking at the hygiene facilities, looking at the triage, etc., and the heating and the water supply and the electricity and the power, let alone clinical diagnostics like radiology, C-arm, etc. These are things that really will be a systems based, and I think the Ministry of Defense as well as the Ministry of Health will have to start looking at a post-crisis phase, a post-conflict phase where they can start to address these issues. But right now, I think the focus needs to be on mission critical equipment and things that are absolutely needed for the warfighter on the front line, physically active and physically engaged. Maybe some of our colleagues have more comments to that.
I can comment on the collaboration with other funds in our Combat Lifesaver program and the handing out of IFACs. We do have some donors that are from inside Ukraine as well as outside of Ukraine. We already started the paramedic training program for the combat medics. That program started a month ago. We now have collaboration with the Pinchuk family to help us with this program. We're moving into other areas as well, but as the Ukrainian World Congress, we are a non-governmental organization. In the end, it is not our responsibility to train the soldiers and to provide all the equipment for them. It's the responsibility of the Ministry of Defense and the government of Ukraine. We are working with the Ministry of Defense. We're starting a working group together with them so that we can come up with a program to pass the combat lifesaver training on to them so that they take the responsibility for it, start training their own troops, and also providing them with IFACs and the equipment that's necessary.
В мене ще, якщо можна, запитання до представника Міністерства оборони.
I have a question to the representative of the Ministry of Defense. Have you calculated the cost of this equipment that is needed to be procured to prevent lethal cases in ATO. My parents are doctors, and I know that the state of healthcare in Ukraine is awful, and we can improve it limitlessly. But now we have no money, no funds, and nothing. But what is the minimal budget to provide that equipment, which is critically important? Ministry of Defense and medical department identified those costs, and just to procure these IFACs, first aid kits, one costs about $100, so 1,000 hryvnias. We don't produce them, but it requires some permissions for an enterprise to produce, and also we need to train our warfighters how to use them. We have bandages, we have this rubber band from Soviet Union times, but that is not efficient. And if we have about 200,000 soldiers and multiply by $100, and also if we purchase these field hospitals and equipment, and just if one mobile hospital will cost us about $20 million, you can make a calculation. And we have 4 of such hospitals, and so that requires lots of money. So that's why we count on the support of the World Congress of Ukrainians. If they help us, Ukrainian World Congress, if they help us, if they give trainings, and everyone who takes part in the trainings, they receive that first aid kits or IFACs, and they want those necessary skills that they need in the battle.
To supply the medical aid kits. And then I have a question to you. I remember one of our earlier briefings, you have pointed those 700 kilos of the medical kits that was stock in US, I think, and could not be supplied to Ukraine because the medical devices were not registered in Ukraine according to legislation, and you had a very much complicated dialogue with the Ukrainian Ministry of Health. So the question is, did the situation improve? Do we have a process that is facilitated, a bit easy? What's the update on that?
After 3 months, we have developed the system together with the Ministry of Social Policy and Customs that we do customs clearance of our parts of IFACs as humanitarian assistance. And now I know there's a law for medical devices which are for warfighters, shouldn't be cleared through customs. They can be imported without taxes, but every time you do customs clearance, for that you need a permit from the state service on medical devices, and we were clearing that as humanitarian assistance. We work together with the customs and with the Ministry of Social Policy. They help us, but that took 3 months, and the process was very difficult. I also would like to comment. John also had a meeting with other donors, not just with us. He had meetings with the World Health Organization, with World Bank, with the American Embassy, with NATO, and others who are in Ukraine. They all are very much interested in this assessment. And we will continue to meet with them so that they can help in Ukraine with such medical things.
To point out, John, are you going to represent the results of your assessment to the authorities in the United States? Because Ukraine is currently seeking support from many countries, including US, and many countries are willing to provide such support. So I think that this sort of report and assessment can be critical. So the question is, are you going to represent it in US?
Yes, this report is, the ownership is the Ukrainian World Congress and Patriot Defence, and I am more than willing to discuss the results with any donor, any potential donor. We will be making the executive summary and key findings and gaps available online as open source, and we'll be making the report itself available upon request for security purposes. We've been in close contact and communication with representatives from the U.S. Embassy, and they are very eager to get the contents of the assessment and the report, specifically with the key findings. I'm not sure if that will lead to any further collaboration or any significant donor support for some of these gaps and some of these significant needs. However, there is a lot of communication with multiple embassies about the assessment and specifically about the core, inadequacies and needs.
Якщо в нас немає запитань, то я дуже дякую.
Once we have no more questions, I would like to thank Uliana and her team.
Ukraine Crisis Media Center, and thank you so much, Dr. John, for conducting this assessment. Дякую, колеги.
Yeah.